Good morning, everyone. Welcome to the very first session of Eyecare Hour, a webinar series by Dr. Agarwals Eye Hospital. We are so excited to have with us today. Our first topic in this series is how to get rid of your spectacles with LASIK, and it will be conducted by a very expert, the Dr. Nita Shah. Dr. Nita Shah has experience of about 30 years in ophthalmology and surgical eye care. Dr. Nita Shah is not only appears to be on a mission to provide her patient not just treatment but an incredible experience in eye care. The spark in her vision translate into sparkle in the eyes of her patient. Before we begin, I would like to remind everyone that we have a special offer on LASIK, which will tell you all in the while concluding our session. So I request Dr. Nita Shah ma'am to take this further.
Good morning, everyone. This is Dr. Nita Shah from Agarwals Eye Hospital, Chembur branch. First of all, a warm welcome to all of you all to join us here on a Saturday morning. Thank you so much for joining us. And you must be wondering what a doctor wearing spectacles is doing, talking about getting rid of spectacles. So I would like to tell you that when I was young in my 20s and 30s, there was no LASIK. Otherwise, I would have definitely had it done for myself. And we are regularly doing enough doctors and eye surgeons after a careful assessment and proceeding with the surgery with very good results and very happy patients. So let us see and let me take you through the whole journey of how we see and assess and manage our LASIK patients. So we start off with how does the normal eye work? So the normal eye works like a camera. This is just so that you would understand what I am talking about. And the camera has a cover, it has a lens, and then there is the film that is the retina, which works. And that is how the object, whatever we see, gets focused on the film. And every part has to be correct. So this flower is falling on the film, and that is how the vision is done. The same way, this is the front of the eye, the cornea. This is the lens, and the retina is the film where the rays are focused. So this is how we see. This is how these football rays are falling on the retina. So what happens for perfect vision is you can see the far off person, you can see the lady in the intermediate range and the nearby fruits also, because all the rays are focusing on the retina. In short-sightedness or myopia, all the rays end up focusing in front, so the distant objects are blurred and the near objects are clear. In long-sightedness or hypermetropia, the near objects are blurred, distance are clear, and the rays are focusing behind the retina. We also have astigmatism, where there are some rays in front and some rays behind, with distance and near both being blurred, what in common layman terms we call as a cylindrical power. So generally we have people coming to us, I don't want glasses, I can't tolerate lenses. So what do we have to offer? We have various things to offer. In laser vision correction, we have PRK, photorefractive keratotomy, LASIK, and SMILE or lenticular extraction. We have implantable lenses and a refractive lens exchange for patients who are not fit for laser. So let's go through this individually. So LASIK is the most commonly performed laser surgery in the world. It's generally done for myopia, hypermetropia, that is farsightedness, and cylindrical power in people above the age of 18 years, because till then the power has not stabilized. We can't predict for the future. We can only take away the power that is existing when we see the patient. So what does it do? So the front part of the eye, the cornea, is microscopically reshaped with the laser so that it acts like the lens which focuses the rays directly on the retina and not in front of or behind it, giving clear vision. The full form is laser assisted in situ keratomileusis. It is also the most successfully performed laser surgery in the world, being pain-free with a fast recovery, with a few disadvantages like dry eyes temporarily, halo starburst temporarily, a mild decrease in contrast, and we do take a flap if we are doing LASIK, and there is no flap if we are doing PRK or we are doing SMILE. So let's go through how we give the patient the best results. The most important thing is where to say no, where it's not to be done. It's not that everybody who comes in asking for the glasses to be removed are taken directly into the operation theater. We use the Pentacam, which is the international gold standard, which checks the front of the cornea, the back surface of the cornea, that is where on the front the laser is going to work, checks the thickness of the cornea, the curvature of the cornea to tell us whether that candidate is a suitable candidate for laser and is also unlikely to have any problems immediate post-op and even 5, 10, 15 years down the line. So that is to be used. A complete detailed eye examination, checking the spectacle power, a retina checkup, use of equipment like the Pentacam, OpScan, or topographer, and very important, a dry eye evaluation is mandatory for us to give a good result. We should also know cases or eye conditions where we cannot do it. That is when the cornea is irregular, like for with scars, etc. When there is epithelial basement membrane disease, too thin a cornea, too curved or too flat a cornea, powers above -12, a very slit eye or with lid deformities, if the cornea has ectasia, and certain eye diseases, especially glaucoma, diabetic retinopathy, other retinal diseases, and infections like herpes in the eye, which are known to keep on relapsing. So these are the cases where we would not do. So what are the standard laser refractive procedures we have? We have PRK, which is done on the surface. We have standard LASIK, which was being done over time, and the femto laser or the bladeless LASIK. Then the SMILE, which is a lenticular extraction, means a small lenticule is cut with the laser and removed, and contoura LASIK, which we will come to by and by. So in PRK, to get a good result, the power cannot be very high. The epithelium is either removed manually, or what we do in all our Agarwal centers is we do that also with laser, calling it a no flap, no cut laser surgery where no instrument touches the eye. Because there is no flap, the visual recovery is definitely there, but mildly slower than what we have in laser. Here I have a small video which shows you how comfortable the patient is while the surgery is going on. The anesthesia used is dropped. This is the laser going on. There is no instrument touching the eye, just fluid to clean off the lasered area and the bed which is done. The first laser was removing the epithelium. The second one was taking away the power. And then we put a medicine called mitomycin, wash it off, put a bandage contact lens, and see in a few minutes the surgery is done. Standard LASIK is when we take away the refractive power. Generally, the maximum we can do is -11 and +6. A flap is created either with the microkeratome or with the femto laser. Then the laser energy is applied. The flap is put back into position and the recovery is very fast. Let's see how it is done. Here I am going to show a video of a patient where we are using the microkeratome. Again, see, the patient is very comfortable. There is not struggling or anything, looking into the light. The microkeratome is applied onto the eye, and then the blade is moved across. Now, this same step we can do with the femto laser, which makes it a bit more comfortable, but this is over in seconds. It doesn't take more than 10 to 15 seconds to do this. And then the flap is gradually lifted again without any discomfort. The patient is able to open his eyes and keep looking at it, all done without any stitches or pain, just a slight sensation that something is going on. And then the laser is applied to take away the power that whatever the patient is having. And then once that area is washed and cleaned of whatever cells are disturbed, by and by, we can take the flap and position it back in a way by which it sticks to the cornea without any stitches. It takes a couple of minutes for it to stick, but as you can see, the patient is totally comfortable. This is an unedited surgery which I'm showing you. And again, it takes a few minutes for us to do the surgery in one eye. And it goes off quite smooth without any pain or discomfort. This is our operation theater. We need to have a good sterile environment to have the surgery going on, and that is what we aim for. If instead of the microkeratome, we use femtosecond, this is a more sophisticated procedure, a bit costlier, but with good fast recovery, where the flap is created with the laser energy, making it more accurate. Now here, if you can see, this is the cut which is done with the LASIK flap, while this is the cut which is done with the SMILE or lenticular extraction, different machines having different names, by which that piece which is removed reshapes the cornea and gets rid of the spectacle number. Contour LASIK, newer technique where not just the power, the aberrations or irregularities of the eye are taken care of, giving a much finer and sharper vision. In fact, 40% of our patients see better than what they saw prior to surgery with glasses or spectacles. Now, why is it needed? We've already described good procedures. So these are some issues that some patients were facing because of the irregularities which are inherent in the eye. So just like the moon has uneven craters, so do our eye have uneven contours. And precision is if we do a lot of little things correctly. So the patient is put through a gamut of equipment. The topography scans around 22,000 points on the cornea. The data getting transferred onto the laser machine. So smoothening the cornea, getting rid of those irregularities, and seeing that the laser technology and ablation profile used does not induce more irregularities, giving much sharper, crisper vision, which, as I told you, is better than before in at least 40% of the people. So what is the care we tell the patients to take? We tell them to take rest on the day of surgery. We do inform them they may have a little bit of burning and itching. What I generally tell my patients is it is a bit like when you wear your contact lens for the first time. You feel there's something in your eye. And the vision keeps on improving, becoming fine in a couple of days. We do not allow strenuous exercise or rubbing of the eyes or head bath to these patients in the post-operative period. We also tell them that they may have a mild tearing in the eye, and sometimes the white part would have some red spots because of the pressure applied with the femtolaser or the microkeratome, which does not cause any harm and goes away in a little while. And sometimes they have a little bit of a sensitivity to light, so there they are told to wear goggles. Also, on the day of the surgery, the vision is blurry, and I tell them tomorrow you'll get up to a new world. Medications are in the form of antibiotic drops, mild steroid drops to take away the little bit of inflammation which is there. Rest for 48 hours and not to rub the eye. A very important thing is laser expectation. This is not magic. It is a science, it is calculation. We need to remember that we are treating living organs. It is not always 1 + 1 is equal to 2. Most patients are 20/20 vision or better. If at all there is a mild error remaining, then either we can do a redo or we can wear the glasses occasionally, but generally this is not needed. If some people are sensitive to light, we tell them to wear dark glasses when they are outdoors. Complications like starbursts or halos. When I started laser more than 25 years back, we would tell all patients they will have difficulty at night. Over this period, going through multiple generations of machines and the advancement, this happens very rarely, especially with contour treatment. A very small percentage may need an enhancement. I think I've done around 3 or 4 in 25 years. We also caution them that at the age of 40 onwards, they would need reading glasses, but that is needed even if you don't do a surgery. It is just a physiological change of our human body. Whatever doubts, queries should be clearly discussed with the surgeon before you decide to go ahead with the surgery. We have some do's and don'ts. So one is instill the drops properly, clean the lid margins. We provide sterile tissues to do that. Diet is normal. Blink generally. What I've seen is that some people have a very low blink rate, like they're like this. So that is where blurring comes in, discomfort comes in. So we tell them intentionally blink, and then over a few days that gets sorted. From next day, we allow them to watch TV and read books and then work on their computer on the third day. Going near the gas is after 5 to 7 days. Till then, they are taking a bath also below their neck. And protective glasses while sleeping, we tell them to do it on the day of surgery. We do not want to expose their eyes to dust, to touch or rub their eyes, to take a shower for a few days post-surgery. We do want them to intentionally blink, and we want them to use the sterile wipe to clean their eyes with closed eyes after the first 24 hours are over. No swimming or eye cosmetics for 1 month. Face cosmetics can be used after a week. Avoid strenuous exercises for the first week and self-driving also for 1 week. Generally, the follow-up visits are day 1, day 7, 1 month, and they go to office within 5 days. But this is flexible depending upon the patient's convenience. They are much more if we do a PRK, that is the no-touch laser where there is no flap. We do see them a bit more frequently till that area heals well. And it is less if the patients are out of station. 7th day onward, even if they don't visit us, it's fine. Suppose someone is not fit for laser, like this gentleman with -14 and -15 power. What we do is we place a lens here in front of our normal lens in each eye separately and give him a much better quality of vision than they would have had otherwise. If they are not fit for this also, we can do a refractive lens exchange where we remove their normal lens and put in an artificial lens which takes away the power. Generally, this is not done for 1 diopter, 2 diopters. It is generally done for higher diopters where the quality of vision is so poor with spectacles and they are unable to have any other modality of treatment, or it is done in people who are 50 years plus and having the beginning of a cataract, where we take it out and give them a lens which takes away their original power too. So this is a word from one of our patients. We do give our patient number. I started how can I get rid of my limp. So I got to know about this. मैं चेंबूर रहता हूँ, so यहाँ पे डॉक्टर अग्रवाल क्लिनिक है. I came here consult Nita Shah. So specific staff there is really helpful यहाँ. जो चाय है वो मेरे पास को ऊपर पसंद है और या ट्रीटमेंट बहुत अच्छा है. I didn't have asked for anything perfect. Nita ma'am is absolutely amazing. She is helpful, really helpful. मेरा appointment जो है next month 11th था, but still I was facing some issues to add and she saw me
And yeah, my experience there was amazing. Nita ma'am is really very kind. And this doctor who have get you LASIK done. Thank you.
So, is there anything more wonderful than seeing life effortlessly? To see is freedom, to see is independence, to see is to live life to the fullest. The dream of spectacle free vision is here. I do tell my patients it is not just cosmetic. You are dependent on an external device to see. Are you very sure you don't want a better quality vision than you can ever have with spectacle or lenses? If it is safe and your eyes are fit for it, why not? It's worth getting assessed at least to see whether you are a good candidate for a spectacle free laser vision correction. Thank you, Dr. Nita Shah, Ayush Eye Clinic, Agarwal Eye Hospital, Chembur, Mumbai here. Now I would give the screen to Mohit to let me know if there are any questions that I need to address.
Uh, Thank you, Dr. Nita Shah, for a wonderful presentation. And now we are opening the chat section for questions. If you have any queries related to LASIK, the procedure, or anything you would like Dr. Nita Shah to address, please feel free to type them in the chat. Will also be reviewing your questions, and Dr. Nita Shah will answer as many as time allows. But don't hesitate to ask whatever it is about the eligibility criteria, post-op care, risk, or any concerns you may have. While we wait for the questions to come in, we have also received a few common queries during the registration process that Dr. Neeta will address now. Ma'am, so there are few questions what our attendees have had while doing the registration. So one of the questions what we have received is, what are the risks involved with LASIK?
So over the years, the risks are very few, almost nil. I would say the results are 99.9% because we have clear criteria, assessment criteria, equipment to assess pre-operatively and decide where to do it and where not to do it. But still, for a temporary period, dryness may go up in the eyes. That is taken care of with lubricating drops, and it's a temporary thing. Very remotely mentioned in the books, infection, power remaining behind, a little bit of enhancement being needed are mentioned, but nowadays we don't see these things happening in our day-to-day treatment.
Thank you, ma'am. So one of the very common questions, the general public have pertaining to LASIK, ma'am. So what is the cost of the LASIK, and is it covered under insurance?
The cost of laser surgery would depend upon which one of the list that I showed we go in for. And it would start with 50,000 for both the eyes, which is like buying a mobile phone, a reasonably good smartphone, going on to onwards. And insurance covers it for certain people depending on their policy, depending on their power. And wherever possible, we do try and help them in getting it done directly through insurance, but it does not cover everybody and it does not cover all parts.
So, ma'am, one more question from the attendee, like, can person having chances of keratoconus undergo LASIK?
Um, when we talk about chances, we need to evaluate what that is exactly. If there is a suspicion of the patient developing keratoconus, then laser vision correction is not for them because we would precipitate something which they would not have got otherwise. If over a period of follow-ups, it is clear they are not developing keratoconus, it is just that some sign showed, then we would maybe take them up for PRK where no cut is done, no flap is made, so the risk becomes removed. So we have to take it on a case basis and decide. Otherwise, we can go in for an implantable contact lens as an option for them if we don't want to touch the cornea at all.
So the next question what we have, ma'am, is like, I have the number in right eye 1.25, left eye 1.75. can I go for surgery or I get age-related glasses after 40 years?
So even if you don't do the surgery, you're going to get age-related glasses. And we are doing some people who are above 40 also, because for whatever reasons, they never did it when they were younger. The reason being what they think, and we agree with them, is that at least they are not wearing glasses all the time. They only need it for near. And the rest of the time, they can manage without the glasses. So yes, you can go ahead with the surgery, understanding that you will need a reading glass when you reach across 40.
So the another question, ma'am, what has come is what happens if I'm not satisfied with the results of LASIK?
So that would depend upon why you're not satisfied, whether you feel your vision is not clear, whether you feel you have too much of dry eyes, whether you feel that the power has been left behind. So each of these can be addressed and treated. You don't need to be permanently dissatisfied. It can be taken care of.
Fine. So one more question, like can a person who is wearing progressive glasses wish to get rid of from the adjustment of eyes on the particular spot of glass to see through, really suffering from neck pain and eye adjustment while working on PC?
Can you repeat?
Uh, can a person who is wearing progressive glasses wish to get rid of from the adjustment of eyes on the particular spot of glass to see through, really suffering from neck pain and eyes adjustment while working on PC?
So if you're saying someone wearing progressive glasses, that means they're above 40 or 45. If I do a laser vision surgery, he will still have a near number because his age is of the presbyopic age where they get a near number, even if the distance is 0. We need to evaluate and see whether this person is a good candidate for the refractive lens exchange, where we remove the lens and then put in a trifocal lens or an EDOF lens, where we can see far, intermediate, and near without having to move his neck all the time. But for that, we need to see the patient and assess whether they are a good candidate. But yes, it is possible.
A question, ma'am, that what precaution should I take post LASIK surgery?
The most important is about not taking a shower, not rubbing your eyes, and not exposing your eyes to dust, not going out without protective glasses, seeing that the medications are put properly, and over a period of time, not going in for swimming or eye cosmetics, even when you start going out for a month, because that's directly in contact with the eye.
A recent question, ma'am. What PVC, like what makes Dr. Agarwal Eye Hospital LASIK setup different from others in Mumbai?
So our group of hospital believes in the best technology. It believes in safety and it believes in patient care. So these three things are very important. And between our hospitals, whatever techniques I've described, whether lenticular surgery, smile, contoura, we have all of them. So it is very important to do the correct technique for the correct patient, depending on their budget. So we are able to provide that in all our hospitals in Mumbai.
Another question, ma'am. Like, does LASIK increase the risk of cataracts later in life?
No, it does not. It's not going in the eye, it's on the surface. Cataract happens within. We are nowhere near the lens, so it does not.
So, like many questions, ma'am, as I, I would request all the attendees, like as many as questions what Dr. Nita can answer, she will definitely answer till the time allows. So another question, ma'am, what we have is like, I have heard that post LASIK surgery, people encounter halo rings around light objects, such as headlights of vehicles coming from opposite side, street lamps, etc., while driving at night. Is that true? What's the case? I've heard that post LASIK people encounter halo rings around light objects.
So as I said earlier, when we started doing LASIK from around the year 2000, we used to tell people that you may find a little difficulty at night. And we used to tell that to everybody. Now, we rarely have to say this. And prior to surgery, we have some markers which tell us who will get it. Like people who have large pupils, where it dilates at night. And generally, when we pointedly ask them prior to surgery, that do you have a problem driving at night? Most of them already have it because their pupils are shaped like that. It is not that it is just because of the laser surgery. This was an issue with the earlier technology used with laser surgery. Now with Contura, it generally does not happen at all because it does not induce any irregularities on the surface of the eye. In fact, it smoothens the already existing one. In fact, I've had some patients where they did have this type of halos prior to surgery, and they have told me it's much better after surgery when I pointedly asked them because I wanted to know for myself how much the technology is helping them get rid of their irregularity. So yes, it may happen. Suppose it has happened, even if it was not there prior to surgery, we do have a remedy of it. And we do have eye drops, which we occasionally give, which prevent the pupil from becoming so large that extra light enters the eye at night. So it's not a major thing at all nowadays.
Ma'am, one question which has come, like, I am into adventure sports or contact sports. Is LASIK still a good option? And if it is an option, then what precaution I need to take post surgery?
So if somebody is doing it occasionally, any of the surgeries is fine. If somebody is doing it professionally, like I have had patients who were like sparring professionally, wrestlers, then the best would be a PRK. Otherwise, if they are fit for smile, because very high cylindrical powers, we have to really evaluate whether to do a smile surgery. We would do a smile or a PRK where there is no flap, so the safety goes up. But yes, laser vision surgery can be done. We just have to select the correct surgery for the correct candidate.
And like, how soon can I fly or take a flight after LASIK is another question, ma'am, for you.
So generally we say after 3-4 days for a LASIK or a smile. For PRK, I would want them to be here for a week or two because we put in a bandage contact lens. We want to see the heating before they travel. It's not taking a flight is not an issue. The issue is the follow-up. So very important in a PRK. LASIK or smile patient can definitely take it on the 3rd day onwards.
The another question, ma'am, which has come in is, if someone is not sure about LASIK till that time, what kind of glasses should one wear with number around -5? As today, lens cut and all are not up to the mark.
So there is a lot of talk about blue filters, etc. Scientifically, the blue filters have not shown us doctors any documented evidence of improvement. But I have had some of my staff also say that they feel less tired when they're working on the computer with the blue filter glasses. There's no harm done with them. The important thing is to put lubricating drops regularly if you're working in front of the computer long hours, because the blink rate tends to reduce and therefore the eyes tend to dry up, causing a lot of strain, blurring of vision, change of power, etc. So definitely you should go in for good quality spectacles and see that the power is checked very accurately, not checked online or at home where you don't have the correct armamentarium to do it accurately, and then go ahead and make the glasses.
Ma'am, another question, like, can LASIK be repeated if my vision changes again in the future?
In some cases, yes, and in some cases, no. But generally, what I have seen is that if you have a -2 or a -3 or whatever, even if you get a power later on in life because of lifestyle, we are all working with some gadget or the other all the time. It generally around 0.25, 0.5. It's not like what you had before where you couldn't go out without glasses.
And ma'am, the another question which has come is like how do I know my cornea is thick enough for the LASIK?
So that's where the pentacam, which I described, comes into play, where the patient is assessed, a printed report is given to the patient, and then it is evaluated as to which technique they are fit for and whether they should go ahead with the surgery or not.
A common question which has like, ma'am, that difference between contour and vision and normal LASIK.
So as I said, a normal laser surgery will take away your power. While taking away your power, the laser energy induces some curvature changes on the cornea, which cause some irregularity. If contour vision is done, 22,000 points are mapped on your cornea. So when the laser energy is given, no new irregularities are put in. And also pre-existing irregularities are smoothened out because the data goes directly into the laser machine, which does a smoothing along with taking away the power. And that is how the quality of vision with contour and the starbursts and halos with contour are far, far lower as compared to a standard laser surgery.
Ma'am, I mean, we'll take the last question for this Q&A session. Like, I am wearing a contact lens, and if I plan to do a LASIK surgery, so when do I stop wearing contact lenses before surgery?
So for evaluation, we would want you to be off lenses for 48 hours, but for the surgery, we would need a minimum of 8 days, maximum 15 days of being contact lens free prior to surgery, because the lens causes changes on the cornea because it's lying there the whole day. So we would be operating with data which is not true, which is altered by the lenses. Once it is removed for 8 days, then the cornea is back to its correct structure and we can do a successful.
So, thank you so much, ma'am. Thank you, Dr. Nita, for the fantastic session. We hope now you have a clearer understanding of how LASIK can help you to get rid of your spectacles. Before we wrap up, please note that you will receive a WhatsApp message shortly on your registered number confirming your eligibility for free LASIK at any of our center at Dr. Agarwal Eye Hospital in Mumbai. Just show this message at the reception when you visit the hospital reception closest to you. If you have any questions or you would like to give a suggestion or schedule your LASIK consultation, feel free to reach out to us. Thank you once again for joining us. We look forward seeing you soon.
Thank you.
Thank you.